Aloha Emba 20. Just calling in, checking in from beautiful Big Sky country in Montana. It's quite cold out here, and I feel like I'm retracing Lewis and Clark's footsteps on the Oregon Trail. And I don't know if you ever played that game, but I'm about to ford the Dalles. Anyways, so healthcare management, it's come a long way since the Lewis and Clark days, but we feel that there's quite an opportunity and a long way to go as it relates to information technology. You know, currently, when a patient needs care, a provider views them as coming into this circle of care with several touch points, whether it's physicians, nurses, pharmacies, and the overall circle is a person's medical records and their healthcare management. We want to take some of that control from the provider and give real-time access and input to the patient, which we feel like will provide better service for the patient as well as give more adequate and timely information to the healthcare providers. And it will keep people healthier and more responsible for their own care management. So currently, you know, every time you go into the doctor, they ask you the same questions over and over again, and you usually fill out the same forms several times. And what ails you? What concerns you? How's your blood pressure? We feel that with the Personal Health Management app, people could be inputting real-time information as they wish. It's up to them. And managing their health for themselves and their families in real time. And that way, a patient could get advice and tips on how to improve their diet or their blood pressure, or if there are several concerning readings in a row with something such as blood pressure, it could trigger a response from the healthcare provider. It could also generate scheduling appointments. It would be real-time data, and it would integrate the several different systems that the providers use and communicate with the patient and the provider. So let's say if you had some kind of outpatient surgery. I know I had shoulder surgery a few years ago, and after you go through the operation, you're kind of sent packing, and it can feel quite disheartening. You can't really get a hold of anybody if you have questions. This would be a way that people could know what to expect with just canned responses, and also be able to communicate real time with nurses and physicians. Right now, a lot of this stuff is being done, but it's just very manual and tedious. It can be frustrating for both the patient and the physician. The physicians are taking on a higher volume of patients than they ever have before. So with the Personal Health Management app, we feel that we integrate all these systems and provide more control to the patient and provide better service as the patient moves through the circle of care. So we will go into the details right after this. Thanks so much. See you guys this weekend.